It's important for people to understand that mental illness is very complicated and medication is very important. There are still many communities in our society and many groups of people who are ashamed to admit they have a mental illness, and they could get better if they got the proper treatment. They're ashamed to go to a therapist. They're ashamed to go to a mental health center. Especially in the African American community, medication is sort of taboo. You don't take psychiatric medication. Women can come to Marian House and live with us, and they can get stabilized and educated on mental illness and their medication and what they need to not be depressed, and to see that it's okay to take those medications every day, and that by doing so, they won't need to medicate with drugs and alcohol.
I think members of the legislature, the general population who hasn't really worked with women in trouble, feel that incarceration is a quick fix. It's easy. Put them behind bars, give them a consequence. That's the easy way out. But we really haven't solved anything. All we've done is punish people. And it is true that we get more from people from teaching them healthy ways to live, rather than just punishing them. Money going into building new prisons, more prisons, is wasted money. It could much better be spent in creating treatment programs, not just drug treatment. You need to treat the whole person, and you need to create a safe and loving atmosphere in order to do that. People have to know you mean it, that you're not just out to punish them, that you really are trying to help them change.
The stories behind the labels, behind the bipolar disorder. If you actually take the time to learn something about them, many times I have thought to myself, there is no doubt in a million years that if I had gone through 1/10 of what this woman went through, I would be a drug addict too. And in so many cases, the things that they've experienced and the things that have happened to them have been so out of their own control. The things that they have done wrong have been simply coping mechanisms.
I think the general public needs to have an attitude that these people are not addicts or don't have a mental illness because that's what they wanted. They didn't ask for this. It was situational because of their environment or because they have the gene that is possible for everyone to have.
When a person is given the opportunity to see what their life can be, then they are motivated. If they are given the opportunity to interact with people who are kind and caring and supportive, then they will be motivated to change their lives. We can be kind and help the women to see another life. You don't see another life when you're in prison. You just see the fact that you want to get out of there and back to the life you had before.
The prospective employers need to understand that the women who come to Marian House are interviewed at the beginning, and we are fortunate to be able to select women who are serious about making a change in their lives. And so we start out with people who really want to change. The prospective employer needs to know that the woman has undergone, her educational opportunities at Marian House, her individual counseling, that she's gotten information on the disease of addiction, and that we are up to date on all the latest treatments, and that we believe that she's ready now to pursue employment and to be a productive employee and to be able to give back to the institution that would hire her. The employer also needs to understand that Marian House is willing to be a partner with that employer. And if we see that the person has relapsed or that there's a problem with the employee, that we will work with the employer to work through the issues to make it a productive job.
We know at Marian House how complex the issues are that these women have faced, and we know what they need to get better. And we know that they can do it. The sky's the limit for anyone. Nobody is without hope.